To the campaign trail now, and today the NDP addressed a little unfinished business. Leader Gary Burrell announced that his government would expand dental coverage for young people up to 17 years old. The program currently covers people up to age 14. If this sounds familiar, that's because it is. In 2013, the party made the same promise but failed to get another mandate. The party says the expansion would cost about $2 million a year and bring coverage to an additional 30,000 young people. Meanwhile, PC leader Jamie Bailey says he has the plan to fix what he describes as a state of crisis in our mental health care system. Today, he unveiled his party's four-year, $39.7 million plan that he says will reduce wait times and improve care.
Nova Scotians are crying out for more mental health service. Every family in this province is touched by mental illness, either directly as a client in our system or either as a caregiver trying to look after a family member who suffers from a mental illness without the help that our healthcare system should be providing.
The PC plan would create mental health services in every school and establish 4 crisis response centers where people could receive treatment instead of going to emergency rooms. Today, the Liberals announced that if re-elected, they would maintain a moratorium on fracking that has been in place since 2014.
Frankly, our province's wealth is built to a large extent on the clean and healthy environment, and neither I nor a Liberal team will embark to put that at risk.
On top of continuing the moratorium, the Liberals announced other measures they say will help protect the environment. Those include new coastal protection and biodiversity acts.
Physicians in Cape Breton are trying to make healthcare a key campaign issue. Yesterday, hundreds of people packed a gymnasium in Sydney Mines to hear from doctors who say the Nova Scotia Health Authority is spreading resources too thin. And they say many of the problems go back to when the 9 health districts were merged into one central health authority.
All new graduating physicians were required to apply to pre-approved locations. And although the public was told that we were trying to recruit doctors to the area, they weren't told is that not every single area was allowed to have as many family doctors as they wanted.
With more on this, I'm joined by Michael Gorman. So Michael, we're hearing concerns, frustration in Cape Breton about the state of healthcare. What are people saying about it today?
Amy, today I asked Liberal leader Stephen McNeil about it during a campaign stop in Halifax. Over the weekend, he wrote an open letter to the medical community and community at large in Cape Breton, attempting to show that he knows there's more work that needs to be done and he's ready to do it. He promised that Northside General would remain open despite some rumors within the community. I asked Stephen McNeil if there's been enough consultation with doctors in the last 3 years. Here's what he said.
We've made a lot of change in how we deliver healthcare in the province. By and large, the vast majority of it has been received very well in communities. But we have heard, and I have heard from doctors and Doctors Nova Scotia who, feeling they were not consulted enough, made it clear that on a go-forward basis, that we would continue to make sure that they're a big part of the decision-making process.
Okay, so that's what Stephen McNeil is saying. What else are you hearing?
I talked with the CEO of Doctors Nova Scotia, Nancy McCready-Williams. She and others met with McNeil on the weekend. She said doctors and the government are still working on improving their relationship since the last round of contract talks, but they're beginning to see signs the health authority and the government are trying to engage more with doctors. She says that must continue. As for the opposition, the leaders of the NDP and Progressive Conservatives said today the frustration doctors voiced in Cape Breton is a sign the government was too focused on making administrative changes to the system and didn't spend enough time talking to and listening to the people who work on the ground and handle patient care.
All right, well, thanks for this, Michael. That's Michael Gorman reporting for us tonight.